let's talk about ACE inhibitors, because if you only know they cause a cough, you're missing the bigger picture. So ACE inhibitors, that stands for angiotensin converting enzyme inhibitors. Basically, they block the enzyme that makes angiotensin 2. Angiotensin 2 is the hormone that's going to tighten up your blood vessels and tell your body to hold on to salt and water. So when we block it, we're shutting down that whole blood pressure raising system. So how do they work? Normally, angiotensin 2 tells your adrenal glands, hey, release aldosterone. And aldosterone is like your body's salt manager. It makes your kidneys hold on to sodium and water, and then it kicks out potassium. So if we're going to block angiotensin 2 with an ACE inhibitor, you don't get as much aldosterone. In turn, that means sodium and water are going to leave the body. So yay, we got a lower blood pressure, but now potassium doesn't get kicked out. So this can lead to increased potassium levels, potassium building up, and lead to hyperkalemia. That's why we always check potassium levels on these patients. Here's another big player, bradykinin. Normally ACE breaks it down, but if we're blocking ACE, then bradykinin hangs around. Bradykinin makes your blood vessels more leaky, and when that happens in the lung, you're going to get that dry, nagging cough. In rare cases, the swelling can happen in your face, your lips, or your throat, and that's angioedema. It's super rare but super serious because it can block the airway. And for these side effects, I always think ACE inhibitors. So A stands for angioedema, C stands for cough, and E stands for elevated potassium. So what do we need to know as nurses before we give the ACE inhibitor? Of course, you want to check their blood pressure. You don't want it to be too low. You don't want them to bottom out. You also want to check their kidney function and their potassium levels, because less aldosterone means a higher risk of hyperkalemia, especially if they have kidney issues. You want to warn them about the cough. If it gets bad, they may switch them over to an ARB, but it's not anything serious. And also, that first dose can hit hard, so teach them to stand up slowly. The three most common ACE inhibitors that you're going to see is lisinopril, enalapril, and captopril.